We are talking this hour about a disease that has affected humans forever, practically. They have found signs of this condition in the mummies that they unearthed in Egypt. Even Otzi the Iceman, the guy they found frozen in an Italian Alps glacier, had signs of arthritis in his body. It's been around for a long, long time. The good news is we're getting better at dealing with it. We're learning more about it and what you can do about it. One of the things we've learned is it's highly related to inflammation. So we're going to start there today, talking with Gregg Russell from Fort Wayne Custom RX about things that you can do to help control inflammation in your body and attack the pain of arthritis. Gregg, welcome to the program.
Well, hi, Lee. Great to be back.
I am so happy to have you back. You know this firsthand, right? You fight arthritis yourself.
I fight arthritis in my knees and in my back. So yes.
Tell me, what does the pharmacist do about arthritis?
I do a lot of things. The lifestyle is really important. For me, movement's really important. I hate that word exercise, don't you, Lee?
I do.
Yeah. So I call it movement, and that is, part of. Unfortunately, it's part of a side effect of us becoming a little more sedentary in life. Our joints don't tend to move as much, so movement's really important. That's one key. The second one that people love to hear about is watching our food intake.
Yep.
Making sure we eat low sugar. Sugar is very inflammatory. Making sure we're limiting the red meats, eating more organic, trying to make sure we stay away from pesticides and other things that can cause inflammation. So there's a wide variety of things. And then, of course, I do use the herbs, too.
All right. Well, we're going to talk about all of that. So let's address it first from the inflammation standpoint. Mm-hmm. And you just touched on the importance of diet. The Mediterranean diet is important.
It's huge.
And that's we've talked about that before, and I think folks kind of can understand that, or you can go look it up, and there's plenty of guidance on the Mediterranean diet out there. But I want to hear about the supplements that you're taking that you think are effective in controlling inflammation.
Sure. So, when it comes to inflammation, I always think in my brain a little bit about pain, too, right? We're going to talk a little bit about pain. So inflammation and pain, most people, as we age, our connective tissue starts to deteriorate. Of course, there's two forms of arthritis, correct?
Right.
So we have osteoarthritis, which is the connective tissue starting to deteriorate from wear and tear or an injury. And then we have things like rheumatoid arthritis, which is an immune disorder, an autoimmune disorder. So we're going to attack them both in some ways similarly, but in other ways differently. Okay, so let's talk about osteo first.
Sure.
So osteo, my herb of choice is curcumin. Curcumin has a lot of positive things because not only does it help as an anti-inflammatory, it's also an antioxidant herb. So curcumin basically is a food. It comes from turmeric, and the active components in curcumin is the curcuminoids. So there are many different extracts of curcuminoids that can help. So that's one of the first ones I use. It's kind of yellow in color, mm-hmm. right? And it's very interesting because it doesn't absorb well. So cultures, they eat a lot of curry, which is the main ingredient, like the Indians. They tend to have also some lower joint diseases, and as a result, they've been using it for centuries, and that's now starting to hit into our culture, and it's one of our top selling herbs, and I think a lot of Americans have heard about it.
Yeah, and I got to tell you, this is a personal experience. My wife, women tend to have osteoarthritis more often than men, and it often starts in their hands, postmenopause. Mm-hmm. This is exactly what happened to my wife. She wakes up with stiff, sore hands, and you recommended a curcumin blend that you have at the store, and she's doing great. She says she's waking up now pain-free.
Yeah, because we know that the anti-inflammatory effect on NF-kappa B is huge, which is an inflammatory cytokine. We've heard all about NF-kappa B, haven't we, with COVID, right? Yeah. And then we also know that curcumin is fairly well tolerated. It's fabulous for the digestive tract. So unfortunately, when we start talking about drugs like ibuprofen or Aleve and other prescription, what we call non-steroidal anti-inflammatory drugs, one of their major side effects is GI bleed. So curcumin does some of the similar effects, but without getting the the bleeding or the stomach upset as much.
So what is special, though, about, if I just go buy, I mean, I can buy curcumin lots of places, and she tried other products, but your particular mixture is different? How? What made it more effective?
I think one of the things is, it's like I said, curcumin is an herb, and then the curcuminoids have to be standardized in that product. Also, the vehicle of how it absorbs. Curcumin is poorly absorbed in the digestive tract. It doesn't like water, so it has to have a little bit of help. And so some people will put like a black pepper extract in it called BCM 95, or bioperine is another name for it. Some of them will use a phosphatidylserine or phosphatidylcholine mix, which is like an oil and water mix that helps solubilize it. In our product, that's what we do.
Okay. So curcumin, a good place to start for everybody for really lots of conditions, but if you're just starting down the road of arthritis, that's where you recommend people start.
Right. It's fairly safe. Most people tolerate it pretty well, and the good news is it has only one drug interaction that I've ever been able to find, and that's with Coumadin.
Okay.
So patients on Coumadin need to be cautious when they take something like this.
And Coumadin, of course, is a blood thinner.
Right.
So the next one up the string, then, if curcumin is just not getting it done for me, what's next?
Then usually I add boswellia. Now, boswellia is a very interesting drug. That also comes from the Indian culture, but it also comes from the Middle East. Do you know what its common name is?
I have no idea.
Frankincense.
Oh,
so
frankincense and myrrh from the Bible.
In the Christian community, that was a very highly prized herb because of its medicinal effects. Again, it has great anti-inflammatory. So on one side of the cycle, we know that we have the non-steroidal anti-inflammatory drugs affecting these chemicals called prostaglandins, which cause inflammation and damage to the joint. Also, on a very similar branch is the leukotrienes. Leukotrienes are associated with inflammation as well as increasing asthma. So this boswellia or frankincense blocks that leukotriene pathway. So again, it blocks that inflammation. So the two things that boswellia gets used for is respiratory or asthmatic conditions and as an anti-inflammatory. So I love it as an anti-inflammatory. And again, that one's usually dosed in a wide range. Now, what's interesting on that one, there's a derivative of the boswellic acids called 5-LOX. So when you go into a pharmacy or you go into a health store, you want to make sure you get one that says 5-LOX on it, because that is more expensive, but it's a much more potent derivative, and it's called AKBA is also the other name for it. So in that one, we tend to dose that about 250 milligrams once or twice a day.
So I'm taking the curcumin and then boswellia with 5-LOX. Is that LOX?
Right.
Okay.
5-LOX. Yeah. And again, if you know how it works, that's why. But again, it has some great efficacy studies as well as the curcumin does against using things like where they compared it right equal to the non-steroidal anti-inflammatory drugs, the NSAIDs.
So I'm taking these to reduce the inflammation and hoping that reduces pain.
Correct.
And if it doesn't get that done, if I still am suffering pain, where do we head then next?
Okay, well then we start looking at some other optional ones. One of my favorite other products is a product called SAMe, which stands for S-adenomethionine.
Oh, and, sure.
Yeah. We'll call it SAMe, okay?
Yeah,
or
let's do that.
It's spelled like same, S-A-M-E, but it's pronounced SAMe. That drug is really good in that it also has actually different medical societies has endorsed it. It's actually endorsed in Europe and is a prescription drug there. Okay, so it's kind of interesting. And this works by kind of stimulating cartilage growth and also repairs some of the different joint components, reduces that deterioration. It also blocks TNF-alpha. Okay, which is kind of interesting. That's what some of the immune modulating therapies for rheumatoid arthritis do too. So it's kind of a little different action, but I'll add that to it. It has one side effect, and do you know what it could be?
No.
Poverty. It's kind of it's a little bit expensive. Sometimes you have to really crank the dose up, and it gets real expensive. It does have some drug interactions. We don't like patients that are taking antidepressants to use it, or a class of drugs called monoamine oxidase inhibitors, and also another drug that is commonly taken called tramadol, which could be used for pain. So we need to screen and make sure somebody doesn't do that, because then they could have an increase in blood pressure and increased heart rate and stuff like that.
Okay, so we talked a little bit about supplements that are going to help you fight inflammation associated with arthritis, but now let's talk about how we're going to cope with the pain.
Sure. Okay.
So over-the-counter stuff, but let's go beyond that. What's the next step if those NSAIDs aren't working for me?
Sure. So as you said, the NSAIDs are kind of the cornerstone therapy for most patients, but a lot of patients don't do well with them. And I have a personal vendetta about people using nonsteroidal anti-inflammatory drugs for long periods of time without going to see doctors. When you see a product like Aleve that comes packaged 250 tablets to a bottle, you're asking patients to endure a long time, and these drugs can cause more problems than they can help too in the long run. So let's say you've gone to your physician. What's your alternatives? Well, if you have osteoarthritis, the NSAIDs are the cornerstone. They might give you an anti-inflammatory like a steroid, which has its own set of problems. Or then we started looking at narcotics, and nobody wants to be on those type of medications. So a new product just kind of came out, went over the counter here recently, called diclofenac, and that's a topical steroid in a cream. And the thought is, if I can give this cream in a smaller dose directly to the joint, that maybe I can minimize some of those GI effects. And I think can be some truth to that. However, we don't know that exactly, how much of that drug's actually get into your system, and long term, if that could still cause the GI effects or the kidney failure effects that are common to those drugs. So that'll be an interesting drug to see.
Before you move on, tell me again the name of that drug.
Diclofenac. And it's in a over-the-counter strength, which I believe is 1%.
Okay.
There's a 3% and a higher strengths that are available commercially that do require prescriptions. We have the ability to take products like that, like a diclofenac or ketoprofen, and put them in a topical cream, and plus the added ability to add other ingredients in it. So if somebody has, for example, a neuropathic pain, which is a different type of pain from pinched nerves, and we can put things like gabapentin topically in it. And what's nice about that is gabapentin tends to cause a lot of drowsiness when taken orally, but when we use it topically, seems like most patients can tolerate it pretty well, and we don't see that.
That's great.
We can maybe also put in another topical anesthetic like lidocaine in it, or other agents like amitriptyline, which also seems to work on that in a different way on the NMDA receptor. So there's different ways, different things that can get added. Baclofen, a muscle relaxant, can be put in. And
so those are all things that are going to be alternative to those NSAIDs.
Correct. Just an NSAID alone. And so again, and that's where trial and error really comes in, Lee. You have to have a doctor that's pretty knowledgeable in using these, as well as us. We got to make sure you've got a good compounding pharmacy that knows how to mix them.
Yeah, okay.
Because we'll put penetrating agents inside them.
There's two other things that are somewhat controversial. One of them is CBD, CBD ointment, CBD oils. Yeah. Are you seeing effectiveness? Are they working?
Believe it or not, CBD in a topical products, not all products are equal, of course, but we have a product that has CBD and arnica in it. Arnica is another anti-inflammatory herb, very closely related to aspirin. And again, that product seems to penetrate well. It's got a penetrating base. It seems to get down in the joint. Again, CBD works on the TRPV1 receptors, which are a little different receptors than the opioid receptors. Doesn't cause the drowsiness. When we do oral drops, we tend to escalate the doses up to 100 milligrams a day. We start lower, 5 or 10 milligrams a day, and kind of go up every few days. And again, some patients respond very well, and other patients don't. So it's kind of a hit or miss.
Okay. And then LDN, low-dose naltrexone.
Yeah.
Now, we did a program on this some time ago, but I've forgotten some of that.
Yeah.
This was a drug that was originally introduced for opioid addiction, right?
Correct. Yeah, they used to take a drug similar to naltrexone, and actually, they used naltrexone first and mixed it with a narcotic medication to keep people from dissolving the tablets and injecting it because it blocked that effect. So we love low-dose naltrexone because it has, at a very low dose, has a whole different effect. Instead of blocking the narcotic drug itself, it's working to actually help reduce the pain sensation. It works on those similar receptors without the addiction potential, without the drowsiness. It has one side effect that we see every now and then. Some patients have problems. It gives them sleep issues. So we start with really low doses and we work it up to kind of minimize that. And they tend to be temporary and they tend to go away.
And these are really micro doses, as I understand.
Yeah. So it's really interesting because we've worked with a couple patients and given them microgram doses. And remember, a baby aspirin has 80,000 micrograms in it. So 1 microgram dose once or twice a day. So virtually almost nothing, but it seems to have this effect to actually minimize two aspects of narcotic drugs. One is it tends to cause less addiction, and it's supposedly over time you'll be able to reduce the dose. In literature, some patients go 40-60% off or completely off their narcotic medications.
So, I think most of us, if you're used to working with or going to a commercial pharmacy, one of the big chain stores, you never really get to have a conversation with a pharmacist. But your information and your goal, your focus really is to have that one-on-one interaction with patients.
Absolutely. That's kind of what we built our whole practice on, is having more patient engagement, learning about what our patients are on, and making sure we actually get the right therapy for them.
And so it's going to be a give and take, right? You're going to try this, let me know how that works, and then you kind of work with the patient back and forth?
Right. And even many of the herbal therapies may take they may take 2 weeks, as short as 2 weeks. They may take up to 12 weeks to work. So one of the things that's really important when patients use an herbal therapy is realize that patients are going to respond in different ways at different times, and so we have to be patient and see get the positive outcome we want.
So you really have to be ready to get in a partnership with a patient, and from my side, I have to be ready to partner with my pharmacist, and okay, this is how this worked, and no, this one really wasn't quite getting it done.
Exactly. Yeah.
Okay. Look ahead. What's out there for arthritis? What do you think is the next big thing?
Well, right now you can see the pharmaceutical manufacturers are really looking at biological agents. They work very effective. They work incredibly effective. The biggest problem with them is, one, they're very expensive, and two, they do immunosuppress you. So you have potential to pick up COVID more quickly, for example, since that's today's virus,
right,
or any other type of flu or so I always worry about things that are immunosuppressing. I want my immune system to be strong. I don't really want it suppressed.
Yeah, absolutely. Yeah. Where do I start in this process? If I'm just getting a little stiffness and it's uncomfortable, is that a warning sign that more is coming, and should I get on it right away?
Yeah, I think so, because what I can tell you is whether it's you're starting with herb therapy or whether you're starting to look at your diet or your movement program, these are things that as we age, we have tendency to be less involved in sometimes our health that we really need to be. When I wish I could have at age 16 when I was playing tennis felt like I had a preview of what I'd feel like at age 60. I probably would have done the things at age 16, wouldn't we all? If we all knew, right?
Wouldn't we all?
It's just hard to it's just always hard to understand, but given that aging is a continuum, so is our quest for knowledge of how to take care of ourselves and improve our own health, which we can do. Making sure we take care of our weight, that we don't get overweight. It's a vicious circle, right? You get overweight, then you don't feel like moving, then you move less, and continues on.
Yeah.
And then you start hurting.
The downward spiral.
Downward spiral.
Okay, so if you'd like to have a partner in your health, I invite you to contact Gregg Russell and the team at Fort Wayne Custom RX. They are at 425 East DuPont Road, online at FW Custom RX, and my thanks again to you.
Thank you, Lee.